Children's Healthcare of Atlanta is committed to bringing you first-class pediatric transplant care. We offer a transplant team where every member is dedicated to your child's health, from the hospital stay through recovery and for the rest of their life. You can count on our team to provide the information and comfort you need. The transplant surgeon performs the surgery and then closely monitors your child afterwards.
The most important thing about a transplant is recognizing that it's not a simple one-stop cure of everything. It's just a continuation of a lifelong of dedication of taking medicines and taking care of yourself. But the rewards of that are a normal lifestyle.
Your cardiologist manages patient care before the transplant and after the surgery. He performs routine biopsies to make sure the new heart is working properly.
Following transplantation, the child is in the intensive care unit and attached to many heart monitors evaluating blood pressure, pressures within the heart itself. We do ultrasounds to look at the heart function, and we do routine biopsies, what we call surveillance biopsies, to make sure that cellular rejection is not occurring.
Your transplant coordinator is a registered nurse who is specially trained in pediatric transplantation.
The heart transplant coordinators are on call 24 hours a day, 7 days a week, and we are the first line call for patients and families. We encourage them to call, and we would rather be woken up in the middle of the night to receive a call from a worried mother than to find out 2 days later that the child is sick, requiring a hospital admission perhaps, and they were hesitant to call when the symptoms started 2 nights ago.
Undergoing transplantation can be a stressful experience for your child. Our child life specialists are here to help ease your child's fears and anxieties.
A child life specialist is a person who helps the patients and families adjust to being in the hospitals. We do that through providing them with medical preparation for surgeries or any procedures that they're having, providing for their emotional well-being by explaining diagnoses to them on a very age-appropriate, concrete level using child-friendly language, using the medical equipment. We do medical teaching using dolls that can help the child understand what's going to happen to them prior to it happening so that they can be prepared for it. We have seen that children experience much less anxiety post-situation if they have had preparation prior to. In addition to that, and helping them develop their coping skills.
Your social worker will help you through the basics of everyday living while your child is undergoing the transplant, providing help with meals, lodging, transportation, and any emergency matters that may arise.
I have the pleasure of meeting the families from the time of diagnosis and the need for transplant and follow them all the way through the process. So we oftentimes start in a crisis situation and try and stabilize that and move forward through the waiting time for transplant and then into the joy and the anxiety of the transplant experience and then the aftermath, all the teaching, the follow-up. So I get to develop long-term relationships with families.
Coping with heart disease is difficult for both the patient and the family. Our psychiatry staff will assess your child, your family's coping strategies, and your previous experience with illness and stress. They're available throughout the transplant experience to help you work through any emotional stress. Your nutritionist will determine your child's needs based on his growth and development patterns and will then develop a healthy eating plan you can follow at home.
Typically, children with heart defects or heart problems don't grow very well. They have trouble eating and getting enough calories in because they have increased calorie expenditure and also just inability to take in enough because of energy levels. After heart transplantation, kids often grow better. Their heart is working better, their energy efficiency is better, and so they tend to utilize their calories better, have more energy for eating, and tend to have catch-up growth once they've had some initial recovery from the transplant.
At Children's, We understand that major surgery can cause a financial strain for any family. That is why we provide you with access to a financial counselor. During the transplant evaluation, the counselor will review your current insurance policy for how it pertains to transplants. She will also go over other programs that may offer you financial assistance. Some families find it helpful to discuss spiritual issues with one of our hospital chaplains or to spend some quiet time in our chapel, which is open 24 hours a day.
There's always an awareness that this is a gift, and it theologically may be framed in terms of grace. There is a real sense of responsibility for the organ and the life that was given up so that their child could have life, and a real struggle sometimes spiritually and religiously to make sense out of that loss and death so that their child might have life. But as a metaphor, heart carries so much significance for us, and to be able to be present and to support that insight and awareness that it's not just a muscle. It has much more to do with meaning of life and the values that the family and the child live out through the experience.
Children's supports each family through every aspect of the transplantation experience, providing guidance and answers when you need them most.